Okay, so I'm going to start off with a few stretches. So some people are very tight and they feel like they just need to stretch to release that pain. Again, in pregnancy especially, generally your ligaments are a lot looser and you're probably a little more flexible than you normally were. So this may or may not be what you need, but I'll just kind of go and do some stretches and kind of talk about which ones are more flexion-based and extension-based. But again, depending on what you're doing with the stretch, it may not be either really, but we'll kind of start from there. So to start off though, if you have any sort of towel, dog leash, belt, anything, I talked about this in the knee strengthening video. I'm literally going to use my sweatshirt that I just rolled up, so be creative. Just do a couple stretches here. So a lot of times people have like some sort of sciatica or like pain coming down the back of their leg, or this here. So sometimes, again, just kind of stretching may help that a little bit. Again, not all the time, and please follow up with someone to get a more personalized exercise routine if you need one. So if we want, truly this could be a good hamstring stretch, but obviously if you're pregnant, that's probably not going to work out so well. So, trying to get myself in this video. What you can do, keep that leg down, use this to help pull until you feel stretched back there. Okay, and then just hold. And if you want, you can kind of, I'll show you here, tap your toe up and down, if you can see my foot, and then pull further. Okay. So that could be one stretch you can do. That's more for the back of your leg here, your hamstring. Stretch out your calf. Again, this is just kind of an extra stretch. Very similar placement, but you want to kind of place it up here so that when you're pulling back here, and it's targeting more of your calf muscle. Okay? So, it's kind of placed there. Again, you can't really see too well there, but and just pulling straight back there. So that's your gastrocnemius that's stretching. If you want to target another part of your calf, you can kind of bend here, just a little bit of bend at the knee, and pull. That's going to target more of your soleus muscle. Okay, so another exercise you can work on in this seated position, another stretch, is your piriformis, your gluteal stretch here. So if able, again, just depending on how pregnant you are and what you can tolerate, if you're able, you can kind of go from here and even just kind of start pulling this here, or lay down, cross that leg. If this is a stretch, awesome, just hang out here. If not, you can reach underneath here and just try to pull as much as you can until you feel that stretch. Okay, you could also, if you don't feel it, try to come across this way, but again, if you are pregnant, depending how pregnant you are, you have a stomach here. You also don't want to be lying in the supine position for too long. So just again, whatever you can tolerate. Okay, so another one here. A lot of times with that lordosis, people tend to have tight hip flexors because your pelvis is rotated forward. So something to stretch out your thigh and your hip flexors a little bit is kind of, so it's just your normal quad stretch, but in the sideline position. So if you can see this here. So this is also if you don't want to do it in standing, if you're too tired and you just roll out of bed, and you don't want to get out of bed actually, you can do it here. So I'll show you what I was doing. So this is just the quad stretch I was doing, but in side lying. So see how my hip flexors are actually very tight? My pelvis is actually a little tilted forward. So really just getting into that quad and that hip flexor there. And really stretching. Okay. So most of those exercises were all flexion based. They're just stretches. Again, but if you're really not tilting your back too much, then it's not really a huge deal, flexion versus extension. The only one that could potentially be extension is the quad stretch I just showed you. However, you really shouldn't be tilting your back there. You should really be focusing on just the hip and the front of your leg in the quad area. So go ahead and try those, and hopefully maybe they'll release a little bit of pain for you. And if stretching is not what you're looking for and you want some exercises, scroll down.